Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. And today we have a very special guest, Vanessa Becker, who's been working at DPHN since the beginning of this pandemic and has really been uh, instrumental to getting the word out. So if you've liked anything we've done about getting the word out about COVID, it has little to do with me and much to do with Vanessa. So we'll get to her in just a bit. So again, if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. Actually, Vanessa is the one who monitors that box. So please send her the questions and we can get them for you. We have one question today that we will get to. So in the world, COVID is going up, and it is going up sharply in Europe and Latin America. Mostly we think to the BA5 and to other subvariants like the BA2-275. So there's lots of different variants out there that are going on, and we're seeing an increased amount of disease. And basically all places that have said, look, we're done with restrictions and lockdowns and masks have started to see a brisk uptake in the amount of disease. The disease doesn't seem to be more serious, although it is resulting in quite a few hospitalizations. So in the US, where the rate has been pretty stable over the last few weeks, I think this week it is up. Hospitalizations are clearly up, although deaths remain about stable. Much of what we've seen is that the people who are getting the disease are people who've had the disease before. Sometimes they've had the disease several times before. So we now have people who are on their fourth documented case of COVID. And these appear to be four separate cases rather than just long COVID, but four separate cases of COVID. And what they report to us is that they're pretty sick each of the times. So it's not like you get this the second or third time and seem to skate by. We're also seeing in people who are immunized. Although what we're seeing is that people who are immunized or vaccinated are not getting as sick, and they're not getting hospitalized, and they're not dying, which is great. But still, there's a fair amount of COVID around. When we look in the US, when we look in Oregon, we look in Douglas County, all of them have rates between 20 and 40 cases per 100,000 per day. Well, these are counted cases. And we'll talk to Vanessa later. We know that for every case that we count, there are clearly other cases out there of people who either don't get tested or they get tested at home and don't report to us. And so the number of cases we report is kind of the minimum number of cases. The true number of cases is probably quite a bit higher. In Douglas County, we're seeing 20, 30, 40 cases a day. It's a little unsteady due to holidays and weekends, but we're seeing quite a few cases each day, and a hospitalization rate, which had gotten down about 2 months ago, down to 5 or 6 per day. Now we're up to a dozen or more a day. And again, overwhelmingly, the people who are in the hospital are people who are not vaccinated and up to date. So it really does seem that although the vaccine is not perfect, it certainly does prevent hospitalizations and deaths. We've not had any recent deaths, which is great. But we're having, I think, an increase is already in the hospital. A few weeks ago, we only had 2 people in the hospital on oxygen. Now we've got a bunch of people on oxygen, some people in the ICU, some people on ventilators. So I think we are seeing a bit of an increased severity as well as a high caseload. The good news is that we have a lot of vaccine. And so everybody 6 months and above can now get vaccine. The vaccines that are available in the U.S. now are made by Moderna and Pfizer and the RNA technology. But the new news this week, and the question we had is, what about Novavax? So Novavax was one of the vaccines that was in the Warp Speed project. If you remember the Warp Speed project 2 years ago, where we asked companies to come up at warp speed with a new vaccine, and starting in the spring of 2020, by the fall of 2020, Pfizer and Moderna both had a vaccine. They went into trials and they started giving them in December of 2020. Novavax also got the money starting in the spring of 2020, and they made good progress, they said, but it's been very slow in coming to fruition. It is a typical protein-based vaccine. So basically what you do is you teach yeast how to make the protein. They make the protein, you then purify the protein, and the vaccine contains the protein. So it doesn't have any of this RNA technology in it, but you can see it is a very slow in development. Had we waited for a protein-based vaccine for COVID, we would have had far, far, far more deaths. So I think one of the things we can say is that during the Trump administration, the Warp Speed project was really truly groundbreaking in getting a vaccine to market. Well, Novavax finally got approved, and we hope to finally have some in the community within the next 2 weeks, so that if there's anybody in the community who wants to get vaccinated but just doesn't want the RNA technology, you can go ahead and get a dose of Novavax. And there are some people who have that reason, and so we're hoping that'll increase the number of people who do get vaccinated. The other news this week is that the childhood vaccines are pretty much all out. And so they're all around to the big clinics, at pediatricians' offices. So if you have a younger child who'd like to get the COVID vaccine, we can go ahead and help with that. And then the last is about the therapeutics. So the therapeutics are either injectable antibody solutions like Regeneron, which we had for Delta. The one we have now is called bevletevimab. And there are also oral medicines called Paxlovid. So the Paxlovid is around. It's there in most of the pharmacies around. It's an oral medicine take twice a day for 5 days after you've been diagnosed with COVID. And it seems to be remarkably effective. 80 or 90% decrease in hospitalizations. Our data here suggests it's 80 or 90% effective in reducing hospitalizations. So really quite a groundbreaking drug. So our recommendation is that if you get COVID, please talk to your provider about whether you would benefit from one of these oral antiviral meds. Generally, the recommendation is you're above 50 or have an underlying condition or just want to take the medicine, you should take it. For people less than 50, there's not a strong recommendation. But again, some people may choose to take it. Anecdotally, it's worked very well. We've had a number of people quite sick, took the Paxlovid, and within a few days, we're feeling better. So again, that's out there and available. So that's where we're at with that. Now, people wonder how I get all of this data. And some of it I come up with myself, but most of it I get from a group of incredible people who are working at DPHN who are collecting this data every day. So when you have a case of COVID, it gets reported to public health. We then report it to the state. There's a state database, and then we do an extract of that every day to see what we're doing for new cases and new deaths and new hospitalizations. And the person who does all of that work is Vanessa. So Vanessa, welcome.
Thank you. It's great to be here.
So a story at the beginning of the pandemic, we knew we were going to need wonderful, smart people to do this. And I had known Vanessa from her previous incarnations as a public health consultant and her work with the UCC board. And when COVID started, we recognized that we were going to need great talent. And we were so lucky to have such great local talent in Vanessa. And she joined us starting at the beginning of the pandemic, and has really been an integral part to our response. So thanks for all of that.
Absolutely. I'll never forget that story of, I believe I saw you at an ESD meeting and sent you an email and said, is there anything I can do to support? And you asked me to come down to the building the next day. And I was working that afternoon with Brian Prowitz, and we did our first video that afternoon on March 12th.
So quick turnaround time. And I think that's one of the things that characterized our local effort is that we use good local people, you for the public health parts, Brian Prowitz for some of the videography part, and it really has turned out quite well. So Vanessa, tell us about the data collection you're doing. So we're producing these daily and weekly case reports.
Certainly. So we started out, as I mentioned, very early on in the pandemic, deciding and talking and thinking about what data do we need to know internally for situational awareness and understanding of what's happening and how is the pandemic rolling out locally. But we also wanted to have some data, not just some data, but data that was sound about how the pandemic was affecting us locally, that we could communicate outward to the community. And so my job has really been one of my jobs has really been looking at the day-to-day data, so pulling case data, looking at hospitalizations, tracking who's hospitalized, tracking our deaths, and doing that internally first. And I literally sit down every morning and have my first cup of coffee as I open up the state database, and I have a little book that I keep all my notes in, and then I put it into an Excel spreadsheet. And so I send those numbers out every morning internally, and for many months, we did that every single day, 7 days a week, every morning by noon. And we're putting out well over 600 updates for well over 18 months with that data, that case data. So, and really it's important to know for that situational awareness. So, if we see new cases, one of the data points that we look at is new cases from day to day. And it's really important to see, on Mondays, oftentimes now we don't have a lot of cases because people are not getting tested or they're reporting it later. So Tuesday usually is a big case day rate. So we monitor that. We look at the numbers. We say, okay, is this a normal Tuesday or is it an abnormal Tuesday? Are we seeing more infections? Are we seeing more people in the hospital? As Dr. Bob mentioned already, looking at the severity of hospitalizations, that's something that we also track. How many people are in the ICU? And we're not only tracking hospitalizations locally, we're also looking at any of our Douglas County residents that are hospitalized in other area hospitals, regional hospitals, even up to Portland, OHSU. We've had patients in California hospitals, we've had patients in Washington. So tracking all of that and getting a good picture of what's happening with our residents in Douglas County and how are they experiencing COVID.
Yeah, in addition to all of those great reports, you've also done a lot of work on infographics. So tell us about these. These infographics have been really popular. And in fact, we've had people from around the country borrow our infographics.
Yeah, so an infographic is a fun project for me. It's a way to communicate. It's a challenge also, but it's a way to communicate health education information, as well as numbers, as well as flyers, things, events like our vaccine clinics. And so it's been a fun. I meant to go back and look and see how many we've created as a team, but it's been a lot of infographics. And we had one the winter of 2020 that had so many hits. Partially, I think it was maybe bots or something on our Facebook page, which that's a whole nother story. But we had so many hits on that that it actually crashed our website. And we were getting requests from East Asia to use the infographic, and hundreds and hundreds of comments about it. And it was particularly about how long are you transmissible? Could you make somebody in your family sick if you went to a holiday party, even though you tested negative? And so it was a very simple visual, but it had a really powerful message. And I think that's the challenge of doing a good infographic.
Right. And, people have one quick these days. I don't think they're looking to read 10,000 words about how to prevent disease. So these infographics have been great. And I think the infographic that you're talking about was one about a holiday gathering, that you might feel good when you go to the holiday gathering, but then come down with the disease on that day and spread it to a bunch of others who then might get sicker, and some might wind up in the hospital or worse. So truly a great infographic along the way. You mentioned the Facebook, and that was another question we'd had actually a few weeks ago, was why we stopped doing Facebook Lives and started doing these kind of COVID conversations. Facebook Live was complicated to do because we would get lots of comments, really negative comments from around the country. And when we checked back on these people, many of these people didn't seem to really exist. They had a Facebook name, but they did not appear to be real people. We did one where we just briefly mentioned a Russian vaccine and got over 1 million negative comments, presumably all from bots. This COVID Conversations allows us to do this in a quieter, less confrontational space. And that's one of the reasons we switched. So Vanessa, what do you see for the future of COVID?
The future of COVID and COVID conversations, or just
the disease itself?
The disease itself. I see it continuing to evolve. I think that we're at and the way I communicate this to people that are around me, whether it be friends or family or work colleagues, is that we're in a much different place now because we have antivirals, we have treatments, we have vaccine, we have people who have had, as Dr. Baum mentioned earlier, who've had an actual infection, separate infections 3-4 times already. And some of them are unvaccinated, some of them are vaccinated. But what we're seeing is that we're seeing the level of immunity and the change in immunity change as variants come on too. So I don't think it's going to go away anytime soon. I know a lot of us are really tired of COVID. A lot of people are, but that doesn't mean it's going away. So it's here. we're just in a much different and a much better position this July than we were even last July, or certainly the July of 2020. So I think we're going to continue it's going to continue to evolve, and our response to it is going to continue to evolve.
And as we've talked about in the past, especially with the state veterinarian, there are so many animal reservoirs now of COVID that it's unlikely that we'll see a time where we're going to get rid of it. So unlike the 1918 flu pandemic, that flu does circulate in other animals, but human flu only circulates in humans. And so there was not a large animal reservoir for flu, but we know there's a large animal reservoir for COVID, and we're worried that it could certainly mutate and come back. So we're still on the lookout, but as you've seen in the last few weeks of COVID conversations, we've talked about other things that we focus on: water safety, smoke safety, wildfire safety. And so there's still lots of work going on there. So Vanessa, in addition to all of this work that you've done on COVID, what other kind of work are you doing over at DPHN for public health?
So I'm also working in what we call public health modernization. So that is funding to allow us to evaluate the public health system, not just the service system, but the system at large, and look for opportunities to streamline it, to collaborate with other community partners, other organizations, to provide both public health information, reduce transmission of disease, and look at larger environmental issues that might have to do with, such as wildfires, hazards, other things like that. What kind of emergency preparedness do we have? So it's a really big umbrella of looking at what are the core functions of public health, and how are we doing that, and how can we modernize that or change that for the better, ultimately to improve the quality of life for people in Douglas County. So I'm excited about doing that work. I still love doing the infographics and the communications part. So I'm that person that as Dr. Bob mentioned earlier, filters all of the Facebook questions and gives that. And I also hope that I can and plan to continue to have my hands a little bit in the COVID numbers as well. I think it's fascinating as an epidemiologist. My background is a master's in public health in epidemiology, and so that part is fascinating and interesting to watch. And I did want to say one more thing about hospitalizations as well, and just to reiterate that Dr. Bob mentioned earlier, as somebody who looks at the hospitalization numbers and deaths every day, as I get ready to report those, we really are seeing a significant impact of the vaccine in reducing hospitalizations. So even, and I've been looking at this data every day for 2.5 years. And so we, after the vaccine was introduced, even, and after boosters were introduced, even if we have somebody who might be vaccinated, which is a very small percentage of people who are hospitalized with COVID, they are more likely to be discharged early, and they're much less likely to die, and they're much less likely to be in the ICU or on a vent. So again, it really is reducing the severity of disease. And if I was to think of one thing to prevent you from going to the hospital or dying of COVID, that would be it.
Good. Well, thank you for all you've done for Douglas Public Health Network and for the citizens of Douglas County. And we'll have you back as the modernization work continues, because that really is great work that you're doing. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. It's good to see you, and we'll do this again next week. Bye-bye.